Hi, I'm Dr. Greenapple with Thrive with another Monday Motivation. In keeping in line with Dr. Palermo and Dr. Fletcher and their webinars on COVID-19, I'm going to talk today a little bit about the long haul effects that we're seeing with COVID-19, primarily dysomia and dysgeusia, the loss of sense of smell and taste. From what the science is showing is about 85% of people that are symptomatic with COVID-19 will lose their sense of taste and smell, and the median return is about 8 days. 25% of these will last up to 60 days, and 15% will be more than 60 days. What's interesting is that on a retro study, the people that did not lose their sense of taste and smell actually were sicker, ended up in the hospital, and even on intubators. So the good news is that if you were losing these things, you actually, from what the science is showing, have a better effect of not getting that sick. With that being said, losing your sense of smell and taste can be quite disturbing from a psychological standpoint, because we know how important it is overall for our senses, as well as the danger. Just think if you couldn't smell gas leaking in the house or even a fire. There's a study that came out about 6 weeks ago in a very prominent medical journal, the Journal of Otolaryngology and Head and Neck Surgery, where they tested acupuncture versus pharmacological agents. The patients that did not respond to the pharmacological agents for loss of sense of taste and smell responded very good to acupuncture. So the efficacy was very, very high, and they're now trying to combine this in use with Western medicine. What's interesting is they used a very formulaic approach. The way that I practice in my practice, I don't like formulaic, although I am using these formulas, but I also practice what's called pattern differentiation. Every patient has a different pattern that walks into the office. Some people will have more of a psychological issue, some people more physical, so we like to look at the patient as a whole, and that's called holistic medicine. With that being said, besides the fact of the formulaic points, we know that because of when you have something like the flu or the cold, you will also lose your sense of smell. But once the nasal passages open up and the congestion goes away, that tends to come back. We're not seeing that with COVID, so we're thinking this is more of a long haul because it's affecting the brain. One of the 12 cranial nerves of the brain, the number one and the oldest of the cranial nerves, is what's called the olfactory nerve. So we're trying to stimulate that and try to regenerate that if it's been damaged. The use of auricular acupuncture and even scalp acupuncture can really help with this. So the beauty of doing things in a functional medicine office like we do it at Thrive is that we can combine Western and Eastern medicine. There's also studies out there in China and Japan where they're bringing Qigong, mindfulness, and Tai Chi into the hospitals to treat people with long haul symptoms and very, very sick patients. My patients, I teach them Qigong and Tai Chi and mindfulness with their treatments with acupuncture because I know that it increases their overall wellness. So remember, acupuncture not just for symptomatic relief, but for overall wellness. We know there's very, very good data supporting the fact that it does increase and enhance the immune system, as well as can decrease some of the symptoms of chronic inflammatory diseases like lung disease and even the bronchioles. So with that being said, you could also add things like nutraceuticals, vitamins such as vitamin A, vitamin D, zinc, glutathione. These things are really helping with wellness, and if you happen to get ill. There are studies out there with loss of taste and sense of smell of using vitamin A and vitamin zinc. Please be mindful, do things that we know that work with science. A mask, if you can get the vaccine, please get the vaccine. Spend some time outdoors, eat right, get some sleep, drink plenty of water, do some exercise, do everything we know that increases your overall wellness. Remember, the best form of healthcare is self-care. So until next Monday, be mindful, and we'll see you on the next Monday Motivation.